Hi, this is Dr. Todd Harris from California Hernia Specialists. One of the most common questions we get from patients during their consultation is, Dr. Harris, I've heard a lot of negative things about the use of mesh, and I want to know whether it's safe for me or not. It's a great question, and we want patients to be extremely comfortable with their treatment plan, so we always try to take enough time to answer patients' questions when it comes to hernia mesh. The fact is, using mesh during hernia repairs is extremely safe. Not only is it safe, but it also reduces the risk of having a recurrence of your hernia by almost tenfold. There have been numerous large studies in the community which looked at patients who were operated on by surgeons who didn't use mesh, and the recurrence rates for those hernias is 20% or more. So 1 in 5 patients is going to have their hernia come back without the use of mesh. They did the same studies and they looked at patients and surgeons who used mesh, and they found the recurrence rates for hernias in patients that had mesh was less than 2%. So there's a significant benefit to the recurrence rates by using mesh. Now, is mesh safe? Absolutely. The newest mesh that's available out there today for surgeons, which we use at California Hernia Specialists, is called ultra lightweight mesh. The mesh itself is extremely thin and pliable and helps reduce the risks of chronic scar formation after surgery. One of the previous risks of hernia surgery with mesh was that the mesh was very thick, and over time a significant amount of scar tissue would form. That scar tissue would then trap the nerves in the groin area and cause chronic pain. But with the uses of the newest, lightest weight meshes, we've found that chronic pain is extremely uncommon after hernia surgery, to the point where we really don't even discuss it with patients because it's so infrequent. So when you look at the risks and the benefits of hernia mesh, we find that the risks with the ultra lightweight mesh that we use for both laparoscopic and open surgery is extremely low. And the benefits are extremely high in the fact that the recurrence rates for those hernias is much lower. So on balance, we strongly recommend patients have hernia mesh during their surgery, and we think that that is the standard of care. We hope this helps you understand a little bit about why we use mesh, and we certainly encourage you in the future, if you have any questions, give us a call. We'd be happy to answer them. Thanks a lot.